I would quickly try to move to the next stuff, which we'll be discussing about contrast arthrography. Contrast arthrography. So arthrography, generally we said, is what? Imaging of the joints. Okay, so we said common joints include the knee joint, the wrist joint, the shoulder joint, and all of that. So contrast is like I'm trying to add something that will give more flavor to the what original imaging, that will make it much more clearer, to bring up much more details, So it's just a specialized imaging technique, and it's used to evaluate what the joint. But this one, you are not doing only imaging, you are trying to add one or two things to make the image much more clear. So a contrast agent has all those iodine base for x-rays, CT scans, gadolinium for MRI. They're the ones that are mostly being used. So contrast will outline what the intra-articular structures, highlight abnormalities such as tears, leaks, and degeneration. Now image is performed immediately after injection. Do you understand? And as I'm actually injecting this joint, of course there are many structures in the joint, so I don't want to injure any one of them. So I'll now use what? Ultrasound to guide my way in, So this is how they do it. Inject it and get the image. So clinical applications, you can use it in all those shoulder joint issues, the tears, the labral injuries. Okay, if there's issues with the knee joint like meniscal tears, cartilage defects, ligament injuries. Use it in hip joint, like those labral tears, femoral acetabular impingement. Also wrist, ankle and wrist issues, then also prosthetic joints. Okay. So indications, you can use it when there is unexplained joint pain, if you have suspected internal degeneration, when MRI and CT scans have not given you the right results you want. There's sometimes before surgeries you actually evaluate the joints, to look at all of that. So I think that's what we got.